Today, we're going to discuss a critical topic in toxicology, anticholinergic medications. These drugs are commonly encountered in both therapeutic use and overdose settings, so understanding their mechanism, clinical presentation, and management is essential. Now, anticholinergic medications inhibit the action of neurotransmitter acetylcholine at the muscarinic receptors in the central and peripheral nervous system. Examples of these medications include antihistamines like Benadryl or diphenhydramine, tricyclic antidepressants such as amitriptyline, antispasmodics like oxybutynin, antipsychotics, and atropine. These medications are widely used to treat various conditions such as allergies, depression, urinary incontinence, and even motion sickness. However, toxicity can occur through overdose, either accidentally or intentionally, or through interactions between multiple medications with anticholinergic properties. Mechanism of anticholinergic toxicity. To understand the mechanism of toxicity, let's take a closer look at the role of acetylcholine. Acetylcholine is a key neurotransmitter in the parasympathetic nervous system, which controls activities such as salivation, digestion, and muscle contraction. It acts on muscarinic receptors found in various tissues, including the heart, lungs, gastrointestinal system, and brain. Anticholinergic medications block these muscarinic receptors, leading to reduced parasympathetic activity. The result is unopposed sympathetic response, leading to various symptoms that we'll discuss shortly. In the central nervous system, anticholinergic drugs can cross the blood-brain barrier, affecting cognitive functions and contributing to delirium or hallucinations in cases of toxicity. Now, regarding the clinical presentation of anticholinergic toxicity. Now, let's discuss the symptoms of anticholinergic toxicity, which can be remembered by the mnemonic mad as a hatter, hot as a hare, blind as a bat, dry as a bone, red as a beet, and full as a flask. Let's break these down. Mad as a hatter. This refers to central nervous system effects including delirium, hallucinations, agitation, and confusion. Severe cases may progress to seizures or coma. Hot as a hare.
I knew I should have taken that lift going to Albuquerque.
Due to anhidrosis or decreased sweating, patients may develop hyperthermia, especially in warmer environments. Blind as a bat.
Are you blind? Are you blind?
Of course not.
Then why do you keep grabbing my goddamn arm? I take your arm.
Mydriasis, or dilated pupils, is a classic finding, often leading to blurred vision and light sensitivity. Dry as a bone.
Todd's as dry as a bone.
Decreased secretions can lead to dry mouth, dry skin, and decreased tear production. Red as a beet. Patients may develop flushed skin, which is a result of cutaneous vasodilation. Full as a flask.
You full of shit. You understand that? You full of shit.
Not being able to speak is not the same as not speaking. You seem as if you like to talk. I like to let people talk who like to talk. It makes it easier to find out how full of shit they are.
Urinary retention and constipation are common due to reduced smooth muscle contraction in the bladder and intestines. Other signs include tachycardia due to reduced vagal tone, and in severe cases, cardiac arrhythmias may occur.
But wait! There's more!
Diagnosis of anticholinergic toxicity. Diagnosis is primarily clinical and based on a history of exposure or ingestion, in combination with the classic symptoms I just mentioned. Laboratory tests include EKG, can help identify cardiac toxicity, especially if a tricyclic antidepressant is involved. QRS widening on an EKG, for instance, may indicate severe tricyclic antidepressant toxicity. Toxicology screens may be helpful, but often do not identify all anticholinergic agents. Thus, recognizing the symptom pattern is key. Management of anticholinergic toxicity. The management of anticholinergic toxicity involves a few key principles. First, decontamination.
Holy fish paste! Get it off me! Get it off me!
If the ingestion is recent, within 1 hour, activated charcoal can be considered to prevent further absorption of the drug, provided that the patient has an intact airway and is not at risk for aspiration. 2. Supportive care. Airway management is critical, especially if the patient is altered or experiencing seizures. Intravenous fluids can help support blood pressure and maintain hydration. Cooling measures such as a cooling blanket can be employed for hyperthermia. And 3, the antidote, or physostigmine. Physostigmine, a cholinesterase inhibitor, can be used as an antidote in selected cases. It works by increasing acetylcholine levels at the synapse, temporarily reversing central and peripheral symptoms. Indications for physostigmine include severe agitation, delirium, or seizures that are not responsive to other treatments. It should be used with caution, as it may precipitate bradycardia or seizures if given too rapidly, or in patients with tricyclic antidepressant toxicity. 4. Benzodiazepines. For agitation or seizures, benzodiazepines such as lorazepam are preferred. They do not exacerbate anticholinergic toxicity and help control symptoms. 5. Cardiac monitoring. Patients should be placed on continuous cardiac monitoring, especially if they have ingested tricyclic antidepressants due to the risk of arrhythmias. To wrap things up, anticholinergic medications can lead to toxicity by blocking muscarinic receptors, resulting in both central and peripheral effects. Remember the classic symptoms using the mnemonic: mad as a hatter, hot as a hare, blind as a bat, dry as a bone, red as a beet, full as a flask. Treatment focuses on supportive care, decontamination, and in severe cases, the use of physostigmine as an antidote. Early recognition and prompt management are crucial in improving patient outcomes. As always, keep your head up. You're doing great. You're better than what you were yesterday. That's a lot. Learn something new today. Going to be a great doc. Sometimes you just got to hear that. Are you an emergency medicine professional or a medical student eager to sharpen your toxicology skills? Well, look no further. EM Toxicology Trainer is your go-to app to mastering the essentials of toxicology and toxicological emergencies. With EM Toxicology Trainer, you can dive into the mechanisms, symptoms, and treatments of common overdose scenarios right at your fingertips. Learn what happens in the body when venlafaxine levels go too high, or how to handle a dangerous Tylenol overdose. Our app makes learning toxicology easy, with concise explanations that reinforce your knowledge to go. No more scrambling through textbooks or online searches when time is critical. Whether you're in the ER or prepping for exams, EM Toxicology Trainer gives you the confidence to tackle toxicology cases with precision and speed. Download EM Toxicology Trainer today and become the expert your patients need when it matters most. Available now on iOS and Android.